Good day. For this presentation, we are about to discuss the development of modern nursing, pharmacy, and medical technology, and CARPER'S 4 patterns of knowing to guide you on how to handle different types of information based on what you know. At the end of this session, you will be able to demonstrate professionalism using critical thinking skills, understand how a particular health profession has evolved and how it is developing, and live out the roots of missionary life by giving importance to the contributions of the past qualities of a medical provider.
Around the world, every health system is struggling with rising costs and varying quality. Disease diagnosis and treatments are designed with the typical patient in mind. Delivery of care is fragmented and focused on volume. The patient experience journey is in its infancy, and healthcare does not yet leverage the full potential of data. In short, there is a lot of work ahead of us. We believe medicine will be more precise and affordable, so that diseases can be precisely diagnosed. Therapy can be tailored to every individual based on their unique characteristics. Lower cost diagnosis and treatments will lead to greater access. We believe value will be at the heart of care delivery, organized around the patient's medical condition and designed to reduce costs with no sacrifice in outcomes. We believe patients will be treated as consumers and engage in managing their health. They will be well informed, have expectations, and exercise choice. We believe healthcare will be digital. Digital technologies will change the very nature of wellness and healthcare. And we believe that together we can shape the future of healthcare.
Alright, so basically with the technology has brought a number of remarkable changes to the health industry throughout the years. It has allowed a number of cures to be created and beneficial changes to be made in treatment and care. So with a constant state of improvements and upgrades, it is important to consider where we are today in terms of beneficial healthcare technology. So here are some of the benefits of the technology in the field of healthcare. First, easily accessible medical information. So what does this mean? So it has become increasingly common for people suffering from questionable symptoms to immediately consult the internet for an answer to their ailments. So this is a great for easing worries or providing answers when your medical provider may not be readily available. It can also save your money by avoiding unnecessary doctor visits. However, looking up your symptoms online can lead to anxiety and panic over simple illness, as your symptoms may be present for a number of different sicknesses. In these instances, it is important to consult your doctor for a professional diagnosis. Second, a larger presence on social media. So with this second one, physicians, hospitals, and clinics have made it a standard practice to create an avenue to the public through social media sites. This is not only grants them a larger audience, but also people an easy way to reach out for information from them. They can offer advice or information specific to their practice, educating followers far and wide. So another great perk from this is that past patients are able to leave feedback or a review of the service they received at a specific medical facility or with a specific doctor. So this can greatly help potential patients narrow down a doctor or facility that they feel could best serve their needs. Third, we have better treatment, equipment, and medicine. So it is no secret that as we move further into the age of technology, a number of benefits emerging. Many would consider that improved healthcare is the greatest result to come from technology. Better equipment has allowed doctors to provide more comprehensive care. Better treatments have increased the quality of life of a number of different people suffering from long-term illnesses. And better medicine has completely wiped out the fear of some life-threatening illnesses of the past. It has also helped speed up research as well as connect medical researchers from around the world. Fourth, we have faster results. So it is used to take weeks or even a month to get the result of medical testing. So with improved technology, it is now possible to get results as soon as the lab is finished with the sample. Many hospitals, clinics offer web portals allowing to access the results within hours or days. And this is incredibly helpful in easily anxiety and providing the answers you seek. So these web portals also allow you to access your past medical records, giving you a chance to keep track of appointments, medical issues, and billing. It is a great way to add convenience for the patient. And lastly, we have improved relationships with patients. So doctors can easily access a patient's records, allowing them to provide better, in-depth knowledge about each patient's medical past and care. Patients' file used to line the halls of practices, creating a large amount of paperwork and eliminating the possibility of finding years past medical records. Now, with, of course, the technology has allowed medical records to be transcribed online, easily available to both doctor and patient. So patients can feel more comfortable with their doctor when he understands their complete health picture. So now, let's have a quick overview on the modern technology in terms of nursing, pharmacy, and medical technology. So how nursing has changed with the technology.
When it comes to caring for patients, all nurses want to help patients recover as successfully as possible. And we want to ensure the 5 patient rights: right patient, right drug, right dose, right route, right time. Technology plays a big part in reaching that goal.
I have to admit, I'm a pretty strong person, but even so, having a medical procedure makes me nervous. So it's no surprise that I was more than a little anxious about my surgery.
Once Ed was checked into his hospital room, I immediately scanned his barcoded wristband to call up his patient record, confirm he was Ed, and verify his procedure.
Seeing Carol using that scanner as a safeguard during my stay made me feel better about being in the hospital. But that wasn't the only safeguard she used.
That's right. The technology I use with my patients enables me to provide safer, higher quality care. Ed's doctor had ordered pre-surgery medication for his procedure. I was able to scan the meds and compare that to Ed's EHR to confirm there would be no interactions with other meds he might be taking.
Right before the surgery, the doctor came in and detailed what my procedure would involve, and he even brought up a video on my bedside tablet. That definitely put me at ease.
During surgery, Ed's vitals were relayed to his EHR and displayed on a mobile cart monitor. They were rechecked and recorded post-op while Ed was coming out of sedation. Once Ed was back from recovery and settled in his room again, I asked him to use the in-room tablet to rate his pain scale and answer a few simple questions to make sure he was fully awake and that his cognitive functions were back to normal.
I was back to normal. All right, or as normal as I get. But it made me feel safe that Carol came in several times to check on my condition, and to know that my vitals were automatically uploaded to my patient record for her and my doctor to review. I definitely felt like every precaution was being taken to make sure I was comfortable and recovering well.
Prior to discharge, All Ed's prescriptions were sent electronically to the pharmacy from his EHR, again ensuring a layer of checks and balances for his post-recovery meds. And as part of his discharge protocol, Ed was given a list of apps to download at home to help him remotely monitor his condition.
The apps on my tablet reminded me when to take my meds, scanned my vital signs, and gave me access to my online patient portal, where I could make follow-up appointments, view test results, get reminders, and send my doc secure messages with any questions. How's that for peace of mind? And knowing everyone really is looking out for my best interests. And the best part? Technology made it all possible.
Those same technologies we used in Ed's room for his post-discharge care are used in other areas of the hospital, including the ER, the OR, and the pharmacy. Today's mobile technologies definitely secure and enhance the patient experience.
All right. So basically, it helped a lot in terms of the technology in the work for the nurses. So in that video, EHR is an electronic health record wherein it is a digital version of a patient's paper chart. So basically, that is a real-time patient-centered record that make information available instantly and securely to authorized users. So with the technology, it really helped and has an impact on the nursing practice. So first here is that technology has allowed streamlining of information management. So with that technology, it contains patient's medical history, diagnosis, medications, treatment plans, and many more. Then second, medications and IV have advanced significantly since the days of nurses making rounds to check intravenous record. So with this image, this is the infusion pump. There we go. So as a nurse, I used this when I was still working in the clinical setting. So basically, this is really helpful tool in terms of providing accurately, in a timely manner, of providing intravenous medications to the patient without any worrying that I might forgot or underdose or overdose of medication. So with this infusion pump, we can already deliver the exact amount or volume of medications to the patients in just few clicks on the buttons of this infusion pump device. Next, technology help nurses with the task of patient education. So basically, with the help of technology, we can send some informations pertaining to their condition or any health teachings that might help the patient improve the quality of their health. The next, communication has always been a cornerstone of healthcare, and lapses in communication can be catastrophic. So in the past, nurses had to page the doctor. Now, wireless communication is the norm and makes connecting with other more efficient. So lab results can be accessed online, and many healthcare facilities are moving toward paperless charting. So in the hospital setting, we are almost digital already, most especially here in the Philippines, wherein we just few calls, we can already notify the physicians or send results immediately to the physicians, and the physicians will right away provide some interventions and faster treatments there. Unluckily here in the Philippines, we are still not doing this paperless charting, but in some countries like United States, United Kingdom, they are already paperless charting, wherein they'll just enter in the computer. But here in Cagayan, hospitals still do with the traditional way of writing in terms of charting, documenting the patient's condition. Then we have telehealth is a fantastic advancement. In some countries, telehealth is already being used, wherein areas in some countries are really far from health facilities, and it takes hours or even it takes miles in order for them to reach the health facility. So with the telehealth, they can just do video calling, video conferencing, and they can already consult healthcare providers, and they can immediately provide some interventions to the clients or patients. So that's how technology help in the field of nursing. So let's move on the pharmacy in the 21st century, enhancing the impact of their profession on the people's lives in the context of the healthcare trends, evidence, and policies.
The role of pharmacy and the pharmacist in the healthcare ecosystem is evolving as disruptive technologies like artificial intelligence and virtual health, as well as environmental, social, and regulatory factors, help reimagine a new integrated future of health built around the consumer and data. From automation to democratization of data, these drivers are accelerating the rate of evolution. So much so that in 20 years, healthcare delivery systems will be dramatically different. But as pharmacy capabilities and clinical breakthroughs advance, how will the role of the pharmacy and the pharmacist evolve within the broader care team? How will technology augment and enhance tasks as this collaboration continues? Regardless of the future path of the pharmacist, pharmacy technology capabilities will evolve in the next 5 years, all for the benefit of the patient. Like Don, who's preparing for his annual physical in the future of health. Before his visit, an AI engine flagged Don as a potential diabetic, so he receives an at-home A1C test kit from his pharmacy. His doctor diagnoses type 2 diabetes. He selects drone delivery for his meds, which are filled and packaged. Don asks his digital care plan avatar some questions about his blood sugar. This triggers an escalation from the AI to a live chat with his pharmacist. Though he's adhering to his care plan, Don's glucose levels are rising. Based on a collaborative practice agreement, the pharmacist increases the dose of medication, and an automatic notification is sent to Don's physician. Thanks to his tech-enabled care team and their data-driven decisions, Don will live a happier, healthier life. No matter where the future of health is headed, you can put plans in motion now that not only embrace technology, but center it on the consumer as new care models continue to evolve with the role of the pharmacist.
There you go. So see how amazing it is with the use of the technology. The patient can no longer or will no longer visit a certain clinic or move from one place to another. With the use of technology, they can already monitor their condition. And just a little bit add up, what does A1C test mean? So A1C test is a blood test that reflects the average blood glucose levels over the past 3 months. Sometimes A1C test is called hemoglobin A1C or HbA1c or glycated hemoglobin or glycohemoglobin test. So ways has impacted pharmacy practice. So first here is electronic prescribing and discharge, timely and accurate transmission of patients' discharge prescription from secondary to primary is important to ensure seamless patient care and also to prevent errors arising from miscommunications, as what you've watched in the video just a while ago. So it is already in accurate way, in a timely manner. There is already a prescription that's going on in the video. With the use of this electronic prescribing, in just few clicks, the patient can already receive the prescribed drug for his medication. Next, barcode medicine has been used with electronic prescribing system and has been shown to reduce medicine administration errors as well as improve the completeness of the medication history, as what you've watched under the modern for the nursing, wherein there's a barcode there. So in just few clicks, it will automatically scan a certain drug and it will inform the pharmacist or the client or whoever, the health provider. They can have knowledge in terms if there are any interaction or any allergies of that certain drug. Next, automated dispensing. So when we say dispensing is giving of medication, this is really cool for pharmacists because With the technology, it will give them an accurate dosage or amount of medicine. Next is adherence of monitoring. So of course, they are being monitored. So as what on that video that you've watched, the patient is being monitored in terms of their blood glucose, not just in terms of the diabetic patients, all other illnesses or diseases. With the help of the technology, they can monitor if there are any sudden changes or any immediate interventions that needs to be done to the patient, and the healthcare team can be notified right away and intervene and provide interventions. Okay, now third is the medical technology development.
Our next career plays a vital role in the field of medical science. We're in the lab today to meet a medical lab technologist. Hi,
Hi, I'm Jody.
I'm Brian.
Nice to meet you.
Nice to meet you.
Let's get lab coat on and get you started.
Great.
My name is Jody Simmons. I'm a medical laboratory technologist, and we're at the Dawson Creek and District Hospital lab. Medical laboratory technologist works in the lab. They run patient samples, blood and body fluids. They're tests that are ordered by a doctor, and we run them on instruments, and we make sure that those results are accurate and precise before we release them to the doctors. A typical day would involve coming in and waking up all our instruments, and then we would have to pull quality control material to make sure that our instruments are running correctly. We would be doing any maintenance, like pulling apart the instrument and cleaning it before we would want to run any patient samples.
What is this machine?
Then we're looking at the inside of a chemistry analyzer. So when someone, for example, comes in the hospital with a heart attack or a suspected heart attack, this is actually one of the instruments we use to see if there's been damage. So you're always learning about new instruments. Your day is always different. Your day is never the same. You might be learning a new instrument, a new technology. In a small lab like this, we are required to draw blood sometimes, so we'll draw the blood and bring it back to the lab. We're looking at tubes, and I'm going to tell what this person's blood type is by using my reagents and these tubes. So if you're an A pos patient, or if your blood type is O, I'll be able to tell from these tests. You're putting drops in tubes, and you're using pipettes and small equipment, and you're doing maintenance, so it's good to be able to work with your hands. It's good to be very organized, so you can organize your workflow and compartmentalize, because you have priority specimens as well. You might get pulled from one thing, and there's a stat that comes in and it's a lot more, has priority over a routine sample, and you need to stop what you're doing and work on that stat specimen from the emergency, for example. Always double check your work,
Sure.
so you do not want to make a mistake. This person's bleeding in the merge, and they need blood quickly. You need to work quickly, but accurately as well. I don't think people realize how closely we work with other healthcare professionals. We work with nurses and doctors quite a bit. So the centrifuge is slowing down. It has spun the two samples together. So basically my patient's cells have just been spun. But if you look here, this is my tube. That there is a blood clot. That's a agglutination of a patient's cells.
So because the blood clumped together within this solution, you know that this is what type of blood?
This is an A person.
Okay.
Because I put A reagent in and the blood clumped, you have an A person.
There you go. So another amazing contributions of technology in the field of medical technologies. So it helped them a lot in terms of their work. So imagine if ever there is no such equipments that they are being used, so they still do the manual things. It will take really long to release the result. So the changing nature of medical technology development, so microscopically examine blood and other body fluids, but through the help of equipments or machines, they can already examine blood and get an accurate result. Next is make cultures of body fluid and tissue samples to determine the presence of bacteria, fungi, parasites, and other microorganisms. So medical technologies are really doing this such procedure in order to check if the specimens have any microorganism or bacteria or viruses that causing the disease or illness of the patient. Then they analyze samples for chemical content or chemical reactions and determine concentrations of compounds such as blood glucose and cholesterol level. An example that I can say to you is the video that you've watched with the reagent. They can immediately identify or determine the blood type of a certain person by just mixing the reagent to the blood of the patient, and they can already determine and know the blood type. Next is type and cross-match blood samples for transfusion. As what I've mentioned, they can right away determine the blood type of the person, and this is very crucial for transfusion because we cannot really transfuse a certain drug to a patient without being properly cross-matched. And if that happens, death will really happen to the patient. And if ever that happens, what we can do as a health provider is really stop the transfusion, and we need to notify the physician and observe for any other signs and symptoms of the patient. Next is evaluate test results, develop and modify procedures, and establish and monitor programs to ensure the accuracy of tests, as what you've watched in that video. So they really checked, clean the equipment to get the accuracy of the test. Then some supervise others in the laboratory. Okay, there you go. So those are some of the contribution of the technology in the field of nursing, pharmacy, and medical technology. Now, let's move on the growth of professionalism. So we have now the CARPER'S 4 Patterns of Knowing by by CARPER. How do I add knowledge to my knowledge base? So the aim of this is to provide professional and discipline identity, create expert and effective practice. Of course, as health provider, we really need to be competent because we deal with life of human being. So we really need to know more on the patterns of knowing. And just to distinguish the difference of knowing from knowledge, so knowing refers to the way of perceiving and understanding self and the world, and knowledge refers to knowing that is expressed in a form that can be shared and communicated to others. So here are the 4 patterns of knowing by CARPER. We have the ethical knowing, the personal knowing, the aesthetic knowing, and empirical knowing. So first is ethical knowing, or also known as the moral component. So focuses on matters of obligation or what ought to be done, and goes beyond simply following the ethical codes of discipline. So when we say ethical knowing, it requires knowledge of different philosophical positions regarding what is good and right in making moral decisions, and particularly in the theoretical and clinical components of the health practice. So it is deeply rooted in the concepts of human dignity, service, and respect for life. So lessening the suffering, upholding and preserving health is one of the key elements why health practitioners is a core service in society. So in your LMS, or in your printed module, there are some examples there being presented. So another example that I can share you is, for example, a nurse presents himself as a patient advocate and defends his client's right to choose care. There. Another example is, for example, me, a clinical instructor, I reprimand a student who is being cheated on quiz and explain the consequences. Then another example is explaining the concept of being organ donation to a terminally ill patient. So these are some of the examples wherein we need to weigh in terms, is it good? Is it bad? Are we making the right decisions for the patient? There you go. So another example is this video.
My mother used to say this about residency. It takes a year to learn how to cut. It takes a lifetime to learn not to.
I'm up. I'm here. What's going on?
Okay, Jackson's BP, it's a little down from yesterday. No big deal, but if we make a few calls, get pushy, maybe we can get him bumped a few spots up on the transplant list.
Dr. Bailey, you paged me 911. at 2:30 in the morning. To chat?
You like to chat. You chatty.
Not at 2:30 in the morning. Look, he's young. He's near the top of the list. You know, we'll find him his organs when they find him his organs, and God knows that staying up all night chatting about it is not gonna help. I gotta get some sleep. I suggest you do the same.
He's running out of time.
They always are. Welcome to Pete.
Of all of the tools on the surgical tray, sound judgment is the trickiest one to master. And without it, we're all just toddlers running around with 10 blades.
You're upset.
I don't get upset with patients.
You're mad at me for killing those women. I get that. Would you feel differently if you knew that I was beaten as a child? Every day. It's how I learned to read. I used to hide under the sink and sound out the letters on the detergent box.
Is that true?
Did it make you feel better? Whatever helps you sleep at night, Dr. Gray.
Cool. Did you do something bad?
Traffic violation. What's wrong with you, kid?
I need a new liver and a new intestine.
Yeah? You want mine?
Why can't I have that nice man's organs? He offered.
You know how in school, there are rules you have to follow? The saying goes, for here, we have to follow the rules or else we get in big trouble. And what that man offered you was definitely against the rules.
No. She's fighting with the insurance people again.
You're not supposed to worry about stuff like that.
Tell her something good today. Even if nothing good happens. She needs good news.
I've got a body full of high quality parts here. 3-day liquidation sale. Everything must go.
Even if we could do it, you have to be a match for him. Which means we'd have to cross-match your blood with his.
Good thing we're both in a hospital then. Let me save a life before I go. It's the least I can do.
So you really expect me to believe that you want to do this for a kid?
Whatever helps you sleep at night, Dr. Gray.
Alright, so there you go. So in that kind of situation, it is really a dilemma in the field of health practitioner. And if you heard the word sound judgment, so when we say that sound judgment is the capacity to assess situations or circumstances and draw sound conclusion. So if you will be that health provider, will it do good? But for that other party, wherein the guy who will donate the parts to that child, he will die. So it's really difficult to weigh, to really give up something like that in terms of organ donation. So it's you to decide, and as long as it will not violate any rules and it will not be against the rules, it is okay to really provide such advice to the patient who will be providing the organ. But for moral decisions, it should be we need to deal with the components of the practice in the medical field. Next is personal knowing, is the therapeutic use of self. So it is also known as the therapeutic use of self. So promotes wholeness and integrity in the personal encounter, achieves engagement rather than detachment, and denies the manipulative and impersonal approach. So with this second patterns of knowing, so it encompasses knowledge of the self in relation to other and to self. So it involves the entirely of the practitioner-patient relationship. So it is the key to comprehend health in terms of personal well-being. So it takes a lot of time to fully know the nature of oneself in relation to the world around. So it also stresses that human beings are not in a fixed state but are constantly engaged in a dynamic state of changes. So personal knowing refers to the knowledge we have of ourselves and what we have seen and experienced. And this type of knowledge comes to us through the process of observation, reflection, and self-actualization. Another example that I can give you besides what is being provided in your LMS or in your printed module is that a health student, strives to promote a meaningful personal relationship with his elderly patient. So that student really strive to really connect to an elderly patient, even though he is not really fun to geria or old people's care. He still, or the student still, strive to really have a good relationship with old individuals or old patient. So here is another example.
Personal knowledge is the basis of the therapeutic use of self in the nurse-patient relationship. It involves perceiving self-feelings and prejudices within the situation. Today, registered nurses Kathleen Jones, Megan Dawson, and the ultrasound tech will share how their past experiences affected their treatment of Mike. Also, Mike will share how his personalized care helped him in his road to recovery.
One of the nurses on Mike's case, I could relate his case to a previous situation that occurred 2 years ago. Because of my previous experience and similar symptoms, I wanted to take an ultrasound to determine if my theory of first appendix was correct.
And while talking to Mike, I put my personal biases and opinions aside and simply just listened to what Mike said.
Special to me because Mike was my son. However, with that being said, I had to put aside my personal biases and emotions for him and make sure that I could conduct the ultrasound precisely for the doctors and the nurses who were involved. It was important for me to stay calm and strong throughout the whole experience for Mike's best interest and everyone else.
Experience while I was at the hospital. After my surgery, when I was in recovery, the nurses allowed my family and friends to visit me even after visiting hours. They knew that as a 15-year-old boy that I would not have a good experience if I had to do it alone. Also, they allowed my cousin to bring in a PlayStation to keep me busy, which was pretty cool.
So next is empirical knowing, or other term as the science. So ranges from factual, observable phenomena, example the anatomy, physiology, chemistry, to theoretical analysis, and it is an evidence-based practice. So when we say empirical knowing, it is the principle from relating factual and descriptive knowing aimed at the expansion of abstract and theoretical explanation. So it emphasizes scientific research is important to nursing knowledge, or not just nursing knowledge but even also in other health profession. So as part of the empirics, clinical and conceptual knowledge are the key to clinical practice. So it focuses on evidence-based for effective and accurate practice. So it is where most theory and research development is concentrated, and some conceptual forms have better capacity to explain the phenomena and others. So other example that I can share is that a student answering a question posed by the clinical instructor based on what he learned from school. Another one is a researcher uses a scientific method to produce the desired study result. Then another one is a medtech who practices the intervention based from the accepted clinical practices. So here is a video for a more example.
Empirical knowing is the pattern of knowing that draws on the traditional ideas of science, as well it relies on what can be seen, heard, or touched. Today, 15-year-old Mike is presenting at the Manitoulin Health Center with severe abdominal pain. After conducting a general survey, registered nurse Megan Dawson uses the empirical way of knowing to intervene accordingly.
All right, Mike, now that you've given me some detailed description of your pain, I'm going to take a set of vitals. All right, Mike, so you told me that you have a very strong cramping pain in your abdomen. And I'm going to ask you to lay on your back to allow me to take a look at your abdomen and properly assess what's going on. Thank you, Mike. In order to get to the root of these pains, I would like to take you for an ultrasound.
Take a look at the ultrasound results that I have.
Of course, let's see here.
Alright, so there you go. So the next one is the aesthetic knowing, or the art to express by individual through his or her creativity and style in meeting the needs of the client. So when we say aesthetic knowing or aesthetic knowing, it is related to understanding what is of significance to particular patients, such as the feelings, attitudes, point of view. So it is also the manifestation of the creative and expressive styles of the practitioner. So aesthetic knowing focuses on empathy, which is the ability for sharing or vividly understanding another's feeling. This is the primary form of aesthetic knowing. Aesthetic knowing also includes the practitioner's ability in changing ways and manner of rendering care based on the client's individual needs and perceptions. It is done by knowing the distinctive individual instead as a typical stereotype whole. So an example that I can share you again is a nurse places himself in the patient's shoes when communicating, giving judgment, and providing care. Another one is for example, a doctor shows compassion, mercy, and understanding towards patients, co-workers, and superiors. Another example, pharmacist Miguel uses layman terms in explaining the need for the patient with right side heart failure. So we have here a video for more example.
Aesthetic knowing involves a process of perceiving or grasping the nature of a clinical situation. It requires that the nurse interprets and reflects on this information in order for them to understand its meaning for those involved. Registered nurse Kathleen Jones now conducts an old cart pain assessment to look beyond the surface of Mike's symptoms to understand him holistically.
First noticed it about a week ago. It's been increasingly getting worse.
I'm really sorry to hear that. Would you be able to point to the exact location of your pain?
It's right here.
Would you say that your pain is constant, or does it come and go?
It comes and go a little, but lately it's been more constant.
All right, and if you could think of one word to describe your pain, what would you say that word would be?
Cramping, stabbing, something like that.
Is there anything that makes your pain worse, Mike? Worse or better?
Well, I haven't tried any over-the-counter medication, but it gets worse when I cough, walk, or bend at the abdomen, so it hasn't gotten any better.
Is there any time of the day that it gets worse?
No, not really.
No, really? All right, thank you so much for answering those questions. Now I'm just gonna ask you a couple questions to help me understand the whole situation. Is that okay?
Okay.
All right. So I wanted to ask you to describe a typical day, what it's like for you.
Well, I get up pretty early to go to school. I'm in grade 10 now, so I have quite a bit of schoolwork this year. After school, I have soccer practice, so I'm on the varsity team. And I usually get to bed at a decent time after hanging out with my friends and doing my homework.
So ever since the pain started, has it impacted your everyday life?
Oh yeah. It started when I just couldn't go to the soccer practice the past couple of days. But then like lately I couldn't even focus on my schoolwork, so I just ended up in my bed at home all day. I've been missing a lot of school lately, so I'm hoping I can just get back to it soon.
Don't worry, Mike, we're gonna take a really good